Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 3 new cases of COVID-19, taking our total to 253 cases. The total number of COVID-related deaths in Manitoba remains at 5. As of this morning, 7 individuals are hospitalized. Of that, 4 are in intensive care. As of this morning, 140 individuals are listed as recovered. There are 108 active cases. Yesterday, Cadham Provincial Lab performed 340 tests, bringing our total to 19,193 tests. As announced earlier this week, we've expanded testing criteria. This includes all symptomatic workers or volunteers at workplaces that have been identified as essential services, any symptomatic person who lives with a healthcare worker, a first responder, or worker in congregate settings such as correctional facility, shelter, long-term care, or residential facility. I want to thank all Manitobans in their efforts to follow public health advice. I still want to caution Manitobans that this virus is still in Manitoba. It is still circulating. That if we reverse our course now, we're likely to see a climb in cases. So we must double our efforts at social distancing and our strategies that have been in place. This is why the public health orders have been extended. This is why they've been enhanced with limiting or restricting travel to the north, as well as the requirement of the 14-day isolation for those returning from other provincial travel. These measures will be in place until May 1st and will be continually reviewed. All Manitobans should cancel all non-essential personal travel. This virus is in every region of Manitoba, so all Manitobans need to take care at this point. Stay home as much as you can. Go out only for essential reasons. Washing your hands frequently. When you are out, continue to maintain that physical distancing, that 2-meter separation. If you're out, you can certainly consider wearing a cotton mask, a non-medical mask. Again, this does not protect the individual wearing it. This will protect the people around them, very analogous to coughing or sneezing into your sleeve. Earlier this month, we had discussions regarding gatherings related to Easter and Passover, and many Manitobans followed our advice to avoid large gatherings even during those holiday times. Next week is the beginning of Ramadan, which again traditionally involves large gatherings. I want to wish all Muslim Manitobans a happy Ramadan, but remind everyone this year that celebrations will occur differently. Many in the Islamic community are already doing their part to reduce the risk, reduce the transmission of this virus in Manitobans. Prayers have been cancelled at several mosques, have closed. These are difficult decisions. These are challenging times for Manitobans, for all Manitobans. But for this immediate future, we need to change the way we do things. And so I'm urging all Manitobans to continue to avoid large gatherings, to connect virtually. But large gatherings right now is not what we need. We need to interrupt the transmission of this virus. So I wanted to remind everyone who is celebrating in the upcoming week to avoid large gatherings. The best way to protect yourself, the people around you, and all Manitobans, including our frontline healthcare workers, is to stay home as much as you can. Wash your hands frequently, physical distancing when you're out in public, and certainly stay home when you're ill, even with mild symptoms. Continue to access credible information. Manitoba.ca COVID-19 is our website. We keep it up to date. Visit that frequently for up-to-date information. So again, thank you to all Manitobans for your efforts. We can see those results in some of these numbers that we've been reporting, but we know the the numbers we're seeing is because of the large efforts of Manitobans. We must continue this course to continue to interrupt the transmission of this virus. So thank you again, and I'll pass it to Lanette.
Thank you. Good afternoon. I'd like to start by thanking the Winnipeg School Division students and teachers for that incredibly inspiring video that we saw prior to the press conference beginning. We have been paying attention to your posts on social media, and it's clear that our teachers are doing everything they can to stay connected with their students, and that the students really want everyone to do everything they can to prevent the spread of this virus so they can get back to playing and learning and being with their friends at school. So thank you to Mrs. Rakrenko's class at Meadows West School for that very important message. The lives of children have been turned upside down in the past 5 or 6 weeks, just as it has for all of us. And they've been forced to learn from home. They've had their extracurricular activities canceled, and they're unable to see their friends in person like they used to do. And it's been a rough adjustment for many of them. So that's what makes these little gestures from children all the more endearing. We've seen kids paint pictures to show their support for healthcare workers, wave to care home residents through windows, and draw rainbows on sidewalks to brighten people's days. The St. Vital Chill Girls 9 and 10-year-old A3 hockey team have been spreading the message about the need to stay home, to wash their hands, and to flatten the curve. With the help of their parents and loved ones, a photo of the team members spreading this message was posted on social media earlier this week. I love the photo and the positive message the kids sent to everyone who comes across it. No matter our age, all of us need to do our part to get our province through this challenging time. We are all in this together, and I thank these kids and their families for doing their part. Okay, on to operational matters. So we've talked a lot over the last few days about PPE for healthcare workers and the need to conserve medical supplies, masks and gowns and gloves for those that are in settings and situations at higher risk for exposure to COVID-19. So it's natural for us to talk a little bit today about the use of non-medical PPE by members of the public or workers who are in lower risk settings. While careful hand hygiene and public health measures like physical distancing remain the best approach to reducing the risk of exposure to this virus, non-medical supplies, including cloth or cotton masks, are another way of protecting others around you, even if you do not have any symptoms. Across the country, we know that many individual sewers and some companies are starting to make, distribute, and wear cloth masks. And we encourage the use of homemade cloth masks in the community and when in public. They can be worn in public settings such as using public transit, during essential shopping trips, and health appointments, either in your home or if you are visiting a healthcare facility. So even if you do not have symptoms, wearing a non-medical mask can reduce the risk you will transmit the virus to others. It's important to recognize that these masks are often homemade. They are not regulated in the same way that medical PPE is. Wearing them should not change your behavior when you're around others. So we encourage everyone to continue to wash your hands before putting on your mask, avoid touching your face when you wear it, and use caution when you take it off, as it could be contaminated on the outside. Place your mask in a bag or directly into the laundry after removing it, and again, wash your hands. Cloth masks should be laundered on a hot cycle and thoroughly dried. They must not be shared with anyone else. And this is just another way that we can work together to prevent the spread of this virus. So thank you, Manitoba. And finally, I want to make note of an initiative to connect vulnerable Winnipeg seniors with the help they need to get groceries or prescription medications delivered to their door. The United Way is partnering with the City of Winnipeg, A&O Support Services for Older Adults, and other organizations on this initiative. Seniors without family or friends can call the city's 311 line to get the support they need. Operators will then connect the caller with the appropriate community resource they need to provide food, hot meals, personal care items, and social support. It's a great project that supports seniors by using already existing infrastructure. So I would like to congratulate the United Way and their partners on this very thoughtful and meaningful initiative. So, and with that, we can open the line to questions.
Thank you. A reminder to our reporters online, you'll have a primary question and a follow-up. First up from CBC Manitoba, Emily.
Yes, so the Manitoba Association of Healthcare Professionals says there's a big discrepancy between the kind of PPE being given to urban and rural healthcare workers. They say the supplies of PPE are woefully inadequate in the smaller regions, and that's putting them at a much greater risk when they're out on calls and working in medical stations. Why are they not getting the same gear that their counterparts in bigger centers like Winnipeg are getting?
So I have not heard that there is a woefully under amount of PPE. We absolutely are prioritizing our first responders and paramedics. It may be that they are looking at, because we've had to switch vendors and look at different options for our healthcare providers to ensure that they have the safety requirements they need, that they may be switching to a different brand of mask, but it still would be, whether you're in Winnipeg or rural Manitoba, the key would be that we need to make sure that the supply, especially those N95 masks where it's fit tested, that the fit testing is done, that the education for donning and doffing those masks occur, and distribution is thoughtful and systematic throughout the province.
Okay, because the association says there is a big shortage in the rural areas as opposed to the urban centers. But so they say as a result, some of the members in the rural areas bought their own N95 masks. They had them properly fitted, but Shared Health sent them a memo this week saying if they go ahead and use that equipment that has been certified and fitted, they'll be sent home and disciplined. So why won't the province let them use their own gear if it's going to make them stay safe and it's the same stuff that the medics are using in Winnipeg?
Yeah, I think the masks, I don't know who fit tested them, but I think that with the N95 masks or whatever kind of mask they're using, they would have to be okayed by our staff health. And sometimes there's a filtration system that needs to be replaced. And so using one mask without the whole process in place of replacing the filter, for example. So I know that Shared Health is working with the paramedics. They absolutely, number one priority is that they have the equipment they need to stay safe. And I think there's a plan right now to distribute the masks, make sure the fit testing is done, and the education throughout the province.
From CTV Winnipeg, Jeremy.
Hi there, Jeremy Sherrill from CTV Winnipeg. Excuse me. We're hearing about a case, a COVID-19 case, at a long-term or a personal care home here in Winnipeg. I'm wondering if you can confirm one of these three new cases, if that is of someone who was an employee at a personal care home.
The public health investigations are still going on with these three new ones, so I don't have anything that I can confirm about that.
Okay, And my second question, in regards to the number of recovered patients versus active cases in the province, we're seeing kind of that trend upwards, and that we're seeing a growing number of recovered patients and a lower number of active cases. Is that a trend you foresee continuing as long as we continue with these physical distancing measures and all of that? What else can you say about those numbers trending in that direction?
Right. So the recovered cases, as we've been saying, is we expect the vast majority of people with COVID to recover. Certainly, 80% will just recover at home. So the recoveries are more of a function of time, and so 14 days after the onset of symptoms, almost everyone will be recovered. So as we reported cases, the recoveries will be about 14 days behind that. So as long as we see the lower numbers of new cases, then the recoveries are going to outpace the new cases, and we'll see that same trend going forward. So it's really a function of time with the recoveries.
From the Winnipeg Free Press, Sarah.
Hi there, Sarah Larnick from the Winnipeg Free Press. I guess with Ramadan coming up, I wondered if there was any concern about health with regard to fasting. Is there any kind of connection you'd be concerned about as far as its impact on immune systems while we're battling COVID-19?
I don't think I would, nothing specific related to COVID-19. I think that the bigger issue with COVID-19 is the typical public health messaging that we've been stated, is to avoid large gatherings, to ensure frequent hand washing, the physical distancing is important, to stay home for the most part and try to connect virtually. So that's where I would focus the messaging regarding COVID-19.
Okay, and then you had said that some mosques have canceled prayers. I imagine that would be something that needs to be widespread. They'd be held to the requirements of 10 people?
Yes, the 10-person, under 10-person requirement in the public health order applies to all faith-based organizations. So it's still they are expected to comply with that.
From the Brandon Sun, Bud.
Hello, Bud Robertson, Brandon Sun. Lanette, I was just wondering how the discussions went yesterday with unions regarding staffing at the long-term care homes, as you mentioned yesterday.
Yeah, it was a preliminary discussion, and I think it was overall positive. Still lots of details to sort out as to how we're going to operationalize it, but I think the unions very much understand the need to limit the traffic in the long-term care settings and make sure that both staff and residents are safe. So first conversation went well, more to come.
Are there any major sticking points to getting this through, Lanette?
Well, are you asking, sorry, Bud, if there's challenges to getting it through?
Yeah, I know these preliminary discussions. I was wondering if there's any sticking points between yourselves and unions that is preventing this from going through quickly.
Yeah, so far we'll continue having the conversations with the unions for sure. Right now, the process that we're undergoing is to really understand the staff working in private personal care homes as well as agency staff, because we don't really have a line of sight. So saying that we want employees to be located at one facility, we have to make sure that we don't destabilize the system by saying that. So part of it is making sure that the services are maintained, but also that this decision ensures safety and decreasing spread of the virus. So we just want to proceed cautiously. We want to make sure we have all our facts straight before we embark upon this. And we do want to move as quickly as possible, so it is a priority for us. And as we know more, we'll continue to have discussions with the unions.
From the Winnipeg Sun, Glenn.
Glenn Dawkins from the Winnipeg Sun. My first question to Dr. Roussin is, you spoke about Ramadan coming up. You spoke about Easter. Do you think the message got out? I know we've seen instances from down south where churches have gone against the health services and that sort of thing. Are you confident that the message got out, and are you confident that the message will get out about Ramadan services?
Yeah, I think most Manitobans have gotten a message, and I think that some of our numbers are demonstrating that. So, right from the beginning, Manitobans have been open to our interventions. We know it's challenging, but Manitobans have been persevering. They're seeing that there's some benefits now being demonstrated by all the hard work they've been doing. And I think that most Manitobans realize that it's too early to stop that progress right now. And so I do have confidence that moving forward we're going to see the same uptake of our messaging.
My follow-up question is to Ms. Siragusa. Seeing the video and seeing the messages from young people, are you impressed with how young people have sort of picked up the message that perhaps some of us older folks have trouble getting? That stay home, do the things necessary to get through this.
Yeah, I am very impressed with our young leaders, and I think they can teach all of us a lot. I mean, honestly, it's really hard on everyone. It's hard on adults and kids, and but yeah, I think we'll learn from each other and we'll celebrate the successes where we can. And yeah, I'm happy for those kids to lead the way for the rest of us. They are inspiring.
From CBC Radio Canada, Laisa.
My question would be, among people that are considered that have recovered, do you have any cases of someone that have been in intensive care?
Has there been a recovered case that was admitted to intensive care? Was that the question?
Yep.
Right. I don't believe any of these recovered cases are. I don't have all of the data on that yet, and so we've been working on trying to report about all of the active cases and the case breakdown. We're going to try to get some more information regarding the makeup of the recovered cases, but I don't have that right now.
Okay. My other question would be, now talking about reopening non-essential business. In other provinces, they're talking about golf courses, provincial golf courses. Is it something that we are thinking here in Manitoba, reopening very soon some non-essential businesses?
We are looking at that. Certainly the numbers are giving us that the early indication that our efforts have been working. And so whenever you put these type of interventions in, we know we can't keep them in place forever, or we don't need to. And so we're going to continue to follow our numbers. We have a working group started right now on when we can start lifting some of these interventions and what that would look like. It'll obviously be done very cautiously and very slowly as we see as we follow the numbers based on as we open up the economy. We have to ensure that our numbers aren't climbing too quickly.
Thank you. We have a few moments left, so we'll open the lines to any further questions. Please proceed.
Yeah, Emily Brass from CBC. So we know you can't speak to a specific patient's circumstances, but what would you say to someone who's already recovered from COVID-19 and desperately wants an exception to a hospital policy so they can visit their spouse who's tested positive and is now in ICU?
Yeah, so the recovered piece of that isn't, we can't say that that's all that relevant right now. We don't know whether immunity is conferred on people. So, in general, we have strict visiting rules for the protection of everyone. It's part of our overall plan, but there are certain compassionate reasons in there, so that will depend on the specifics. But I would say the recovered COVID piece, we probably couldn't put much weight on that specifically right now because we still don't have all the data on whether this confers immunity.
And the exceptions for compassionate reasons, does that apply to patients facing imminent death, or is there room to consider each individual case, since there's only a few patients in the ICU at this point?
Yeah, so the visitor restrictions do leave room for compassionate reasons. Specifically, we wrote those with the intention that if someone's at end of life, that they are not by themselves. So if that is a situation that is happening, I would encourage the individual to connect with the hospital facility and consider whether an exception can be made in those circumstances. Absolutely, it's case-by-case basis.
As part of at the Sun, Dr. Rubin, do you think people aren't fully understanding about immunity? I still hear from people writing on social media saying, everything's good, I'm immune now, but people not getting the message that that's still the case here.
Yeah, we can't really say that for sure. We're a ways away from doing these serologic studies to be able to tell whether immunity is conferred on people, and then we don't know what the duration of that immunity might be either. So I would say at this point, no one should be relying on a presumed immune status. All Manitobans should be taking the precautions that we've outlined.
And the health, sort of take up all the time here. The medical expert for CBC is talking about possible waves this fall into next year. Do you foresee waves happening, even though you're following all these strict measures right now?
Well, certainly in pandemics, we often will see more than one wave. We see that often with influenza as well. So we sure need to be anticipating it. We're going to be dealing with this virus for some time. Certainly until we can have a pharmaceutical intervention or a vaccine, we're going to need to deal with this virus in one form or another. It's very unlikely that we're going to need to deal with it in these strict measures. We can't have these strict measures in for forever. But as we loosen these measures, it's very likely that we'll see some increase in case counts. So we'll have to be monitoring that. It's possible we may have to cycle some of these measures. So it's really early. Every jurisdiction is still learning from even the first wave of this. So it's we're not sure what the next wave would look like, or what kind of measures we'll need to keep in place.
Great. Thank you both.
Hi, Sarah Larniuk, Winnipeg Free Press. I'm wondering if you're able to confirm any outbreaks at medical facilities in Winnipeg.
We have. I don't. I don't think we have any specifics to comment on that. As far as
currently.
No current outbreaks right now.
Sorry, there are no current outbreaks, or you're not able to confirm there are?
Yeah, I'm not aware of any current outbreaks in a healthcare facility right now.
Okay, perfect. Thank you.
Emily Brass from CBC again. There have been some encouraging numbers lately with the recoveries. Has there been any consideration given to restarting non-urgent surgeries like hip and knee replacements that were canceled a month ago to prepare for a surge in COVID-19?
Yeah, absolutely. And again, this is the wave of the pandemic. So we are having discussions about opening up and increasing our surgical volumes and both the diagnostic testing as well. So they've been reduced for about 3 weeks. And it's probably not a level we can sustain too much longer. So we should see some increase in that I would say in the next week or two, we'll see increased volumes coming back in surgery and diagnostics.
And this concludes today's media briefing. Thank you.
Thank you.